And this is also one of those times too where, because we're not so deep, we're not in mode 1, you guys can also just decide to work clockwise. That's fine as well. Okay. But yes, so 8 to 12 treatments every 2 to 4 weeks. Now, in terms of like how to decide, you're like,
Let me ask you a question.
Sure.
Well, is it, the machine still gonna beep and let you know when to move, or are you just going to, when you're doing the refit, you're just gonna automatically just keep on moving it?
You're gonna keep moving it, yeah, no matter what. And I'm gonna show you some different techniques this afternoon.
Yeah.
You guys can kind of figure out which ones you like best, which you feel most comfortable with. But yeah, you can just keep it moving. You can keep your foot on the foot pedal. We have a foot pedal option, and just kind of keep going around in circles. I think ergonomically, I prefer that the most. We also have a trigger. If you wanted to do individual pulses, you can. You can hold down the trigger. You can do it each time. But it's totally up to you. So there's a whole list of things you can do to kind of tailor it to however you feel comfortable. Most comfortable. So I would do every 2 weeks on younger patients, like anybody who's like less than 60. You can do every 2 weeks. Maybe older than 60, you would just wait maybe like every 4 weeks. Only reason being is just like as we get older, it takes longer for our tissues to heal. Yeah, so that's just kind of how I would do it. But know that you have the 2 to 4 week window. Adds flexibility for your patients too. And another side note too, we don't talk about it here, but when you are treating for collagen production, we know that it takes anywhere from like 3 to 6 months for collagen to fully build. So sometimes with maybe not so much this, but more with our ST, you get a little bit of what we call Cinderella effect. And that means you get like that instant like contraction of the tissue. So you're getting an instant like lift of the eyes if we're treating around the eyes. You get that instant plumping of the lips because of that lymphatics we're working with. So let your patients know that that's not going to like last per se, but that's our end goal. And when you're taking your before and after photos, I would advise wait until the maintenance treatment after to do those after photos, because that's going to be closer to what their end point is, their end result, because that collagen synthesis takes that long. So I'd just like to clarify those things. I don't like to say like, oh, well, this is what your lips are just going to look like from now on. Like, no, this is what they look like right after treatment. It may last you a couple of days. It's a Cinderella effect, which is awesome if you have an event to go to this weekend or whatever it is. But this is what we want our end result to be. So it's going to take consistency, making sure you're doing these treatments, and then we'll take your after photo 3